Okay, we should be good to go now. Good morning, good afternoon, everybody, and thank you for joining this high-impact thought leadership panel co-hosted by EthAum Partners and NyuktAI. This is Pankaj Gupta, Managing Partner at EthAum Partners. We are a deep tech revenue scaler and fund based in Singapore with approximately 120 startups in our portfolio from different parts of the world, stages, and sectors. Today, we are diving straight into one of the most pressing questions facing hospital leaders in 2026. How can clinical grade agentic AI meaningfully improve hospital operations, clinical workflows, and ultimately profitability without adding any complexity or risk? And that's a big question that hospital groups are facing today, not only in India or in Middle East or in UK, but globally. Over the next 45 minutes, we will be moving beyond hype to candid questions where agentic AI is really creating measurable lift in hospital operations and profitability, what the real barriers and proofs are, and what C-suite leaders must demand to make it profitable at scale while following all the regulatory compliances and regulatory frameworks. Thanks to the extremely diverse, intelligent, and exceptional C-suite panel that we have today, who are going to share their insights from their real life and on-the-ground experiences. Now, I would request Dr. Geetika to go first and introduce herself. Dr. Geetika, please.
Hi everyone. Good afternoon, good morning, good evening from wherever you're joining in. First of all, thank you for having me on this panel. Very interesting discussion I'm hoping we'll have. So, like I said, my name is Dr. Geetika. I have currently worked in healthcare for the last 22 years. Presently, I am with Medanta Hospital at the enterprise level, where I am part of the core team, which is working on making innovation and making healthcare delivery smoother, more patient-oriented, where we do not have to compromise on the quality of care and making processes more streamlined. Yep.
Thanks a lot, Dr. Geetika. And I know we discussed about this, that you are looking at quite a few different solutions at Medanta
Yes.
to bring the innovation, to bring the transformation in the overall operations. So I think you are one of the best panelists to talk about this topic today. So really appreciate your time today. May I request Nishant to go next, please?
Sure. Thank you. Thank you so much, Pankaj, and everyone. Hello, everyone. I'm happy to be part of this elite group. I represent, or I rather work for Apollo, one of the largest healthcare conglomerate in India. I've been part of the marketing stream for almost about 7.5 years now. And basically, when Pankaj reached out, I was pretty amazed with the topic. I realized that this is an in thing. Everybody's talking about it, and everybody wants to know whether it's going to be helping us or replacing us. So I guess the larger question we cannot answer possibly in 45 minutes, but definitely with the elite panel that we have, I will also learn something. So happy to be here.
Thank you. Thanks a lot, Nishant. And obviously, who doesn't know Apollo? So I'm sure that you are going to share insights that are extremely valuable today. So thanks a lot for joining us today. Ayman, may I request you to go next, please?
Thank you. Hi, everybody. So thanks for having me. And my name is Ayman Ababneh. Currently, I'm general manager for a UK company specialized in the digital healthcare and AI called openmedical. And I'm managing also the global expansion, especially in Middle East. And my experience is diverse in medical devices, supplies, and digital for more than 17 years, and also specialized as a PhD in strategic innovation. And this topic is actually, I consider it like, is the true test for the AI game changing in the market. If it's AI agentic, do it, then this is a revolution that's coming there. Thank you very much.
Thank you, Ayman. And I know that you are you have very deep expertise network in Middle East and UK, while you have been building, selling promoting various digital and AI health solutions. So I'm sure your experience is going to add tremendous value today. So thanks a lot for joining us today. Professor Abhay, may I request you to go next, please? You're on mute.
Thank you and good day, everyone. I'm a practicing surgeon, so very much at the cool face of looking at how AI is creeping in our lives. I'm quite excited. I understand what the challenges of adaptation are, so I'll be absolutely keen on having this discussion with all my other panel members. And rightly, as Nishant said, today is more about learning as well. So happy to be here.
Oh my God, you guys are extremely modest. But when you say creeping in your face, is it in a good way or bad way, Professor Abhay?
So Pankaj, actually, it all depends on which view you take. If you look at it as an assistant, you feel happy about it. If you see it as a competition, you're very scared about it.
Yeah.
And this is a real challenge because AI cannot do everything. There's such a human component in healthcare that healthcare from an AI perspective can never be seen as a technology solution.
Yeah.
And the question is going to be, yes, AI can help me diagnose, but can AI diagnosis be acceptable to a patient?
Yeah.
So there are a lot of challenges. We'll discuss it over the next 45 minutes.
Definitely.
Mixed
Thanks
feelings
a
at the
lot.
moment.
Dr. Taneja, please. You're on mute.
Hi everyone. So this is the second surgeon on the panel. I am the second surgeon on the panel.
Amazing.
Yeah, and I had been executive physician basically, working at managing corporate hospitals basically, practicing surgeon, healthcare consultant, and right now faculty for doctors AI certification course of AI in medicine for the doctors. Plus, I am a research scholar working on creating learning health systems in India basically. Of course, it's by default application of big data and AI, how we can optimize for India.
Thank you. Thanks a lot, Dr. Taneja. And your decades of experience is going to add a lot of value today. And obviously, if you are teaching to the doctors, then that's even more fascinating. Now, I would request Sujit to go next and introduce himself. Sujit is not only co-founder of NyuktAI, but he's also the moderator of this panel today. So he has a lot of weight on his shoulder. Sujit, please.
Thanks, Pankaj. Hello, everyone. Our privilege to be in this panel to be discussing about the application of technology in healthcare. And as you guys have said, that you would be learning, I will be learning a lot from you guys. So, about me, 2 decades of experience in technology and establishing technology systems in regulated industries. I've been into media tech, I've been into fintech, I've been into health tech, and with NyuktAI, we are building this Agentic AI operating system where we are actually solving this problem of how regulated industries can adopt AI. So that's about me in a nutshell. Over to you, Pankaj.
Fantastic. Thanks a lot, Sujit. And now let's start getting insights and feedback from the panelists today. So Sujit, please go ahead and let's moderate the panel. Yeah.
Great, sure. As we know that AI in regulated industries is needed, but it has not been adopted the way it has been adopted into various other industry sectors. So over the next 45 minutes, what we will be discussing is move the hype beyond candid discussion and where agentic AI is already creating measurable impact in the healthcare sector and breaking the real barriers, and we'll also get to real case use cases from your experiences so far. So I'll start with the first question, which would be in the starting point to know about the real pain points. So my first question would be to Nishant, because he is more into the business transformation and looking at the revenue side of the healthcare part. So, Nishant, to you is hospital margins are under pressure globally due to staffing shortages, revenue leakages, length of stay inefficiencies, are many such roadblocks that is basically inhibiting healthcare to scale revenue faster. So what are the 2, 3 operational or financial leaks where current tools or basic AI are falling short of?
Thanks so much, Sujit, for the question. I guess to look at it broadly, all industries have their own weak points, and obviously tightening them have immediate gains that comes through. For hospitals, I have it's my belief from what I have seen. I think logistics is one big large area where you need comparatives to come in, etc. That's one area that we feel internally that has a lot of application that can happen on come through AI. A lot of help can happen through AI. The other thing we feel is obviously the medical records, the access to them, including prescription. So the flow of information from doctor to patient to the back end, and how it can drive compliance within the medical sector. Because that's one thing we feel is that it helps patients enormously. And I always thought that while AI is always looking at the systems internally, it has to look out externally as well. Because if we empower the patient, I think the use of AI can also increase on either side. So I think that will augment the cause in a very large manner. Because if the patient gets to see what the doctor is trying to explain in a simplistic view and can understand and then it will get adapted fast. I mean, I would not try and exactly correlate, but if you see the usage of search engines, when they came in at the start of the use of internet, it really threw us off in orbit when we actually, everybody started using search. It was not just meant for corporates, it was meant for each and everybody. So the chat GPT has come in a large way for that as a platform, and various other platforms. So I guess consumer or patient empowerment, I feel, is a large sector that AI can influence. And obviously, it can be managed and it can be looked after by the medical resources. Doctors are at the center of it all. If they are governing and AI is following, I think patient can be benefited in a very large way.
Great. You are heavily from a FMCG background. So do you see any similarities or maybe dissimilarities of implementing, let's say, a solution like a AI system into both the sectors?
Well, I always believe FMCG was slightly easier because you're looking at distribution-led models, and they are more B2B2C. Where healthcare is concerned, you're larger, it's patient to doctor to the hospital setup. So you have less interventions or other people coming in. So it can be much direct, but I think it has its own advantages because you have a direct approach. So AI can solve for a lot. And as I said that many times we always feel that, consumer or patients in our case, when they come forward, they are listening to the diagnosis. Are they able to comprehend it? Is it coming across to them through the patient file that has been given to them? Are they actually going through it, understanding it? So if there is an ease of communication that comes through, that's the best part of it. It's like, we talk about patient rights and responsibilities right now. Can it be made for the patients to easily understand when they're coming in for the admission? So many processes and systems are there which are available in the hospital system that can be made easier in terms of if AI can just jump in and start communicating it in a way that the patient understands. So the larger decoding, I think, is still left. FMCGs usually would always, or larger consumer companies would always look at AI to solve for the distribution. But I guess we would look at AI solving for knowledge itself and how it's disseminated across patients from the medical sector.
Yeah. Thanks, Nishant. Now I'll ask Dr. Geetika to add some inputs into it because I mean, with your experience in Medanta and transforming the digital, driving the digital transformation in Medanta. So, what is one of the top operational or financial risk that you want to highlight about?
So just taking from where Nishant left, so Nishant, like patient acquisition, search engine. So that's the top line you're talking. Now, when we're talking about revenue coming in, we have to also look at the service delivery. So one part is the communication with the patient, but on the other side is also the experience. Now, if I like mid-cycle leakages, so there are procedures happening, but the consumables are not getting billed. So if there is a pathway which the agentic AI can sort of help, where we are neither overbilling is done, neither nor is underbilling done. So there has to be a system which will help us sort of track the entire stay, say the hospital stay. Or the other example which I see daily is the length of stay. A lot of discharges get delayed because pre-auth hasn't come in, because the documents were not there. So if there is a filter from agentic AI that, okay, these documents are missing, it flags, it just flags, it adds it on, and we move on from there. If we are able to achieve that, and we are able to sort of get the length of stay even by half a day, and we have more capacity without adding any capex, without adding any manpower, we can accommodate more patients, our services,
Absolutely.
and obviously the patient satisfaction as well. A lot of
Right.
patients are waiting for 6 hours to get discharged, right? So along with whatever we're getting on the patient side, incoming flow, we have to also manage the service part of it operationally as well. I think it plays a very
Yep.
important role
Yep.
there.
Thanks, Dr. Geetika, for this. So basically, you are talking about a system which basically becomes an intelligent bridge between all the stakeholders in a healthcare ecosystem. So whether it is the insurance providers or the non-admin clinical staff and the patients, especially. So thanks, Dr. Geetika. I'll now direct this question to Ayman, who obviously is driving the healthcare technology in healthcare in the GCC region. So, Amin, would you like to add on to your specific example from the region?
Yeah. Thank you very much. Actually, I will just add additional perspective, and let's say from macro level, if we look at the current systems that we spent the last decade digitizing in healthcare, EHR, the AI tools, and RBA, all of these technology, we have built real faster versions, but fragmented the process. If you look at the margin of the hospital, still under pressure, because these tools, with the great, excellent results that happened before as a foundational tool, they did a great job. But the problem is they are one-way technology. You can say it's passive technology, it's reactive technology on the best case. They can tell you something that is wrong in the hospital in terms, for example, the discharge or in the claim denial or whatever the case, or in the cancellation rate in surgery. All of this stuff can tell you, notify you about it, but cannot go into the system and fix it. This is the missing gap, which I can call the unfinished business for the automation and digitization in healthcare. Especially that this tool is still dealing with only the structured data, that like 20% of the available data. There is no lack of data in the healthcare. There's a lot of data, and that makes this system in a blind spot for the unstructured data. From this macro point of view, we can see that the most drainage or leakage is in the healthcare, in the part related to the revenue cycle management. So I do believe that this is high complex process, that the current automation check the claim status and checking the route for the claim status, but it cannot deal with the change. If, for example, a porter layout or complex denial requires clinical reasoning, so the basic AI in this case can predict denial, but leaves the correction to human. That's why hospital losing a lot of money, maybe in some use cases, 3 to 5% of net revenue annually in this regards. I will also mention, add also my voice to my colleagues that the demand and supply part in the hospital is a major leakage and financial risk. So when it comes, for example, to the discharge, and the supply chain and material order management in this case. You see that the discharge is a really a domino effect process in the hospital. So if the system can tell you the patient is there, but cannot manage multi-team, multi-sites, multi-department to do the final job and discharge the patients. And this will impact, of course, the capacity and the financial results of the hospitals. So in this case, that's one area. The other area is, for example, in the OR, the operating room, because of the cancellation rate and the no-show. And as also the surgeons here can also add on that operating room is a heavy cost in the hospital, around 60% of the revenue, or you can say around the cost in the hospital. So managing the scheduling part and the cancellation part is really a major issue to manage this leakage in the hospital. So that's
now that you mentioned about, sorry to cut you. You mentioned about the supply chain part, and I want to pinpoint that part for GCC specific. I couldn't stop asking right now, considering the situation that GCC is right now amidst this conflict. So how do you think supply chain, or let's say procurement for a healthcare system, is getting impacted? And how do you see technology, or a technology like AI or agentic AI systems would be helpful in bridging that, or solving those challenges?
Yeah, that's really a great point. I mean, to see the impact of technology and AI agentic. Because as you know, hospitals and healthcare system is a really heavy logistic hub. And large of the cost is coming from the supplies there. And large of also the delay in the process is coming from the supplies issues. So the current state is really not enough, because the human capacity to manage the huge information and building scenarios is very limited, and cannot manage that, especially, for example, the scheduling, the reorder point, building scenarios of the expected demand and surge in, let's say, for example, in gloves. So we need such a system that this system is a closed loop system that can manage all of these structured and unstructured information, and really build a really forecast, and not only build the forecast, because current systems already do the forecast for the inventory, but you needed to do the full process there and reorder with minimum human, of course, intervention. This is important because at the end we don't need doctors to supervise robots, or the clinical team to supervise robots and AI. We need less supervision, so the human can deal with the human and give more care for the patients.
Great. Thank you, Ayman, for your responses. Now let's move on to the more serious part in healthcare, which is the clinical side of the healthcare, and where, as Dr. Abhay, you mentioned about that, can really AI replace doctors, which is obviously we all know that we can't. And now for that. The question to you is, Dr. Abhay, agentic AI obviously is autonomous agents that reason, plan, and act and adopt. So, what do you think a clinical grade AI looks like to you in a context of imparting clinical grade care to patients?
Thank you, Sujit. I'll first start by saying healthcare is one industry where everyone expects perfection. And it is inbuilt in your psyche. It is not an experimental area at all, which is the biggest challenge you have right now. Technology is experimental. Even today, most of the models reach 60%, 70% accuracy, right?
Yep.
What people don't realize is healthcare inherently is a very flawed industry. Doctors make 20% errors, but it's not known to the world, which is why people absolutely trust their doctors even today.
Yeah.
The second part about, as I was hearing all the conversation, people are forgetting one very interesting problem about healthcare. Healthcare is not one problem or another, it's an ecosystem play.
Yeah.
You cannot affect supply chain without actually making sure the clinician is working properly. You cannot say, I'll look at this problem, but that problem can stay as it is. So until unless you're willing to look at the entire data flow as an ecosystem play, there is no answer to what can change. Nothing can change. I'll tell you this out of failed experiments. Let me put a very simple perspective that robotic surgery was introduced in 1990. It's 30 years ago. After 30 years, I still need human supervision. It's 30 years now, and we still supervise every robotic surgery with a human. No robot is allowed to autonomously operate, ever.
Mostly.
So you need to understand the psyche that is really prevalent in healthcare before you start talking about adaptation. The psyche is, I cannot afford to have any mistakes. I want perfection. So when you look at adaptation, you should start solving the simplest problem where risk can be accommodated first before you start taking it to the higher and higher levels of complexity. When we looked at the solution, and I presented a paper at the World Economic Forum on this, the key problem that AI can start helping today is access to the right opinion when to seek medical care. Not what medical care, but when to, what we call as pre-hospital triage. Even today, 30% of hospital deaths are due to delayed care. 30%. We're not talking 1%, 2%. People wait for a few days hoping things will get better. Things don't get better. By the time they reach a tertiary center, they're almost moribund.
Yep.
The second aspect to addressing agentic AI is a fantastic thing, but they are not perfect yet. Even today, when you look at any agentic model, the model will stop at some stage and you'll need some human input in order to make it work. So this creates a black box fear. Now, humans are so used to cross-check everything. The moment I autonomously allow an agent to do what I'm doing, I need to know exactly why is he not doing certain thing or why is he doing it wrong. So this fear of the black box is the second challenge for adaptation. Now, how do you resolve it? The resolution is actually start talking about healthcare adaptation as a team, not as a manager, not as an executive, not as a single clinician. Get a whole team. Every stakeholder has to be on the table. Secondly, build your sandboxes. These sandboxes are critical. A sandbox is where you will try your adaptation, but also complement with the human oversight. Don't say, my supply chain problem is solved, so now everyone's happy. It's never going to work. Never say that I've actually introduced it automatic scheduling, it's going to work. It never works. Let me put a second perspective. EMRs came into existence in 1970. Find me any hospital where more than 10% of clinicians are in love with their EMR. Not one single hospital in the world. Every doctor will universally hate the EMR. And the reason for that is it was never built for the clinician. It was built by a technology guy who thought, oh, it's such a nice idea. No one took the stakeholder. And I'll tell you, I was a part of a failed 16 billion pound experiment in UK. I was one of the young directors of National Program for IT, which was a 39 billion pound ambitious project by Tony Blair to modernize our health service. We spent 19 billion and then closed it. And the key failure is again this inability to understand the ecosystem. Everyone tries to solve one problem at a time. So when we start talking about healthcare, how do we transform healthcare? How do we get AI involved? Start solving the small problems first. The simplest problem to solve today is language. Come to my hospital and I'll tell you, I practice at the Cromwell. I'll tell you, literally every second patient needs a translator. They're coming from Spain, they're coming from Perth. Why can't I? Even in India, not everyone speaks Hindi. So what about a Tamil patient in Delhi? Why can't I say the simplest problem to solve is let people talk with each other properly? Secondly, our data is fragmented. Even today, the second problem to use agentic AI, in my eyes, is actually to say, don't create data silos. Doctors are only as good as the data they receive.
Absolutely.
Now, if Geetika, Nishant, you'll all agree with me that today our data quality is poor. And if I want to empower my patient, there's only one thing I need to give them, a health passbook. Like they have a financial passbook, they need a health passbook where everything about their health is recorded. It doesn't need to be in common man's language. It could be in Latin, gobbledygook. All they need to do is be able to show it to the next doctor who wants to see it. Right?
Yes. Yes.
Those are the areas where I would seriously say that if you want to transform healthcare, think simplicity, think adaptation. Don't start at a complex end and don't think about one problem. Start thinking about how can we create an ecosystem play. The smaller problems that get solved as a team.
Thank you, Dr. Abhay, for this. You highlighted and cited very key and pertinent issues in the healthcare, and that some of the new technology companies are trying to address. And this is the primary barrier to entry into the healthcare ecosystem. I'll like Dr. Dev to add on to this. So as Professor Abhay mentioned that adoption is not smooth, and there are so many challenges in the healthcare for a doctor to adopt or rely on technologies like AI or agentic AI. But there is a scope. There is a hope it will reach a stage where it will reduce those burdens on the healthcare practitioners. So, Dr. Abhay, so, as per your experience, what do you think are the biggest practical barriers in the healthcare industry from your experience that is basically inhibiting clinicians or surgeons like you to adopt or use or rely on technology for that matter?
Yeah, thank you. So I'll come back being an executive physician, I was also group coordinator for hospital management information system implementation also of a corporate group. So I have number two, now we come to the peculiarities of AI. So in AI, the biggest thing in the healthcare is basically all the medical devices, they cannot be deployed sooner. They need to be registered with the regulators. Now we have classes of medical devices. They are known as software as a medical devices if they are used as a software as a model. And in case they are within a medical device, then software in a medical device. Now here we have three classes. Class one, where and it is related to the patient safety risk. So whenever that output of that particular device, so the least safety risk to the patient, they are class one. And as they go, highest is class three, basically. And if now, second thing, what is important in healthcare, we have to have, because a doctor is accountable for the patient's health outcome. So if he accept that output blindly, then there will be challenge for him because he is accountable to the patient. So one is this accountability issue. So that is one major thing which we all need to understand. Number two, now what we are right now, the topic is about the agentic AI. So we have LLM, etc., etc. So in agentic AI, what exactly we do? It is basically, it is not a passive agent. Here, an agent can think, reason, and act on its own. So multi-agent solution. So right now at one spectrum, we have a passive agent chatbot, which is just replying to a thing. And at the other end of the spectrum, the multi-agent AI, where it coordinates various workflows and reason out, thinks over, understand the bottlenecks and come out with solution and acts. And it prompts to the next level, basically. So this is the thing. Now in healthcare, the two things which are important, how much autonomy to be given. So whether it should be 100% autonomous or a semi-autonomous. So in healthcare, there is a phenomenon which is we call as a human in the loop in the medicine or doctor in the loop. So wherever that criticality of the patient safety is concerned, all those outputs need to be verified by, there has to be a clinician oversight. So all those things are semi-autonomous. Now administrative job or care or coordination of the hospital, various operative work, basically, where clinical care is not involved, but those are repetitive tasks, basically. It impacts basically the hospital productivity in various ways and the finances. So here now, basically there, the autonomous car, there is a huge potential. And already few hospitals have started doing all those things where it does not impact the patient safety. the output. So these are the basic things, and now within this spectrum we have to work. So right now we have right now on the one left end of the spectrum where we are slowly started moving from the passive agent to little more complex things, multi-agent. But it is whatever examples we are seeing, it is more on the administrative side or the certain operations which does not involve direct clinical output basically, or which where the potential for patient harm is very less. So those things are basically. But going forward, we are looking at that is the end scene, like what future looks like if the things move in that place. Third, in the healthcare, we have our own peculiarities. One, we have data silos, and then silos of the workflow within the hospital system. So there are so many challenges basically. One is from the hospital at an institutional level. So when as a leader, basically, if I have to look at that, if I have to implement that particular thing, so what are the barriers to this, adopting that particular multi-agentic AI? What are the risks involved? What are the capacity? What are the regulatory issues? What are the type of the business process reengineering I need to do? What type of a change management? How do I get my clinician basically buy-in from that? How I prepare training and other things from my team basically, and what the whole system will look after the AI implementation basically. So what are my KPIs there, like basically. So so if it has to be taken as a strategic initiative rather than a technical project, because 10 other hospitals are doing.
Correct. So what? Please go
last
ahead, Dr.
point,
Dev.
right? All the hospital, they want to be best, but in future, what exactly everyone is looking at the efficiency part. Everyone is effective, but now efficiency, so ROI and other things will come into the picture. So the idea is if you take it as a strategic initiative, so basically efficiency, basically ROI point of view, and number two is the clinical outcome point of view. So the thing which will impact both the clinical outcomes and the ROI basically, and third is my productivity, how I improve the productivity of various areas. Thank you.
Thanks, Dr. Dev. So basically, the non-clinical and the repetitive administrative functions are the low-hanging fruits for technology to be addressed with, and obviously it is a ecosystem effort, or the effort goes from both the side, from the hospitals training the clinical staff, non-clinical staff, as well as the surgeons, doctors. They also need to be made aware of how to use a particular technology. So it's a two-way effort that will ensure that technology, like intelligent technologies like agentic AI systems and all, are getting a impactful breakthrough into a healthcare ecosystem.
Just a moment.
Sure.
One half, 30 seconds. See, digital health, by technically it means IT part. In India, we have Ministry of IT, basically METI, what we call. And the second part is the healthcare part, which comes under the Ministry of Health and Family Welfare. So if I see the IT part, they are capable of doing anything. So that pillar is always bigger. But hospital industry has always been laggard from CMA model point perspective of other. So they need to get their basically hard work after again. Thank you.
Correct. Thank you, Dr. Dev. Dr. Geetika, would like your input onto this. So now, from whatever Professor Abhay and Dr. Dev has highlighted, so from that, accountability of or ownership of any technology system should fall under it's a big question, and it's a big area of discussion that is surrounding around AI being adopted into healthcare. That who would be the accountable? Who will be, is the technology provider who would be accountable, or the AI system, or the doctors for that matter, or the hospital for that matter? So, Dr. Geetika, from your experience.
Actually, that's very relevant when we're talking about the adoption bit. See, what happens is that if a technologist is building something without keeping the doctor in the loop, it's not a silo. So most of the times when a software is getting built, it's done by a technologist who doesn't understand probably, or doesn't have a view on what everyday operations or clinical challenges a doctor would face or a nurse would face. So I would say that first the silos have to go. Accountability will only come when the team works together. Accountability is, I think, the second layer in the system, where first is you identify a problem, what exactly is happening on the ground level, you solve it together, get the AI into the picture, and then see the accountability. Like Professor Abhay was mentioning, that there are regulations which need to be seen, and everybody expects healthcare to be perfect. We cannot expect any mortality, any morbidity, any complications coming in. So it is very, very important to keep all these aspects in mind when we are designing the system, which has to have visibility of the complete ecosystem.
Thank you. Thank you, Dr. Geetika. Professor Abhay, you wanted to add something to it.
Yeah, as it stands today, the accountability is 100% with the doctor. And that is a big challenge. It doesn't matter the technology is flawed, it is giving you wrong answers. Ultimately, it's expected that the doctor is smart enough to decide what is right for his patient. Now, this is in itself a massive barrier for adaptation. Now, you need to see it from a medical perspective. That if every error is only my problem, why would I want to take any risk? Right? So the second aspect of this is AI in healthcare is one of the most hotly debated regulatory topics right now. Every government is trying to create a framework around something they don't understand. That's a challenge. None of us actually understand how does the AI thought process work. Now, I'm not sure whether you guys are aware or not, but literally Anthropic's latest model broke its own safety barriers.
Yeah.
Anthropic mythos. And it's a big worry that if AI agents become autonomous and they start giving you answers which are completely counterproductive, and then me as a doctor have to take responsibility for what they are suggesting. So I don't think we are ready for yet to even understand how AI will actually be ingratiating itself in the medical world. And the reason for that is agentic thinking is not clear. So we will always have to have guardrails whereby we create frameworks where it's not a single agent or a single model that is effectively giving you your answers. So it's a very, very liquid space. I don't think anyone's got a clarity, but that's where I'll stop.
Nishant, you want to add something to it?
Yeah, so Dr. Abhay has been extremely clear in bringing out what's actually helping bring the barriers in. So rather, what I would always say is that the barriers eventually create answers. The guardrails that we speak about, if they get diluted, then what happens? So is the risk actually that is mitigating the use and the worry? And I guess it's basically something, the challenges are within the system, not so much outside it. The more you solve for the challenges within, I guess the answers then would come from outside. So that's another part of it that's coming at you.
Yeah, absolutely. On that note, let's dive into the specific impact zones, Nishant. So, where do you see agentic AI creating the most defensible ROI right now?
Well, I think in terms of it creating ROI, the ease of use was always the backend, and everything starts from the backend because nobody wants to expose it to the patients first. As Dr. Abhay also said, Dr. Geetika also mentioned, and Dr. Dev also said that anything and everything hospital and doctors are held responsible. So there is always a lot of cautionary tale that's coming in, and I guess in terms of ROI, it's getting restricted to the backend. So whether it is logistics, purchases, I won't even say length of stay, etc., is being counted for. That's still much more manual. But in terms of getting the pricing strategy right for purchases and all, at least that bit, some bit of it is getting through AI, and that's where the ROIs are coming through. But it is definitely, adoption is not, I would not say even at 20-25% as of now. So I get it leaves a lot of space to look at, but I think the future is bright because as it comes in with so many guardrails and people talking about it, and then discussing like these panels where such stalwarts are there, Professor Abhay, Dr. Dev, who are actually the midst of everything, solving for things. I guess more and more such panels should open up, and the discussion should be brought out in the open.
Absolutely. And what I feel and what we know from our experience is that not even 20-25% adoption healthcare in the actual production level, it is even would be less than 5%.
I would say.
That would be higher, I guess. Thanks, Nishant, for this. Emin, what one metric has moved meaningfully in real deployment of agentic AI or AI systems for that matter, from your experience?
Yeah, I see that. I mean, I do agree that the fastest and defensible impact is in the administrative back office here. So I can say there are two areas there which we can see really a defensible impact: the revenue cycle management process and prior authorization. So while the clinical AI is really transformative, the agentic shift, moving from tools that just suggest to the systems to actually execute, is currently solving a lot of problems. I mean, especially in USA, the $140 billion manual processing crisis in the healthcare billing there in USA. And this is related to the one metric that I can say that meaningfully in real world deployment, which has an impact, is the first pass approval rate in a claim process. So in a legacy system, around 15-20% of claims are denied as a part of like doing business, administrative exhaustion. But in agentic use cases for authorization, that there's use cases now completing 40% of prior authorization, even without human involvement. That will help a reduction in denial claims and also help in the collection part of the money. So that's one area. The other area, which is related to the also care coordination and operational navigations that include umbrella, that include chronic care management, referrals, discharge, cancellations, all of that. So the follow-up scheduling, it's a very expensive area. So agentic AI can coordinate across teams and system, ensuring the follow-up appointments are booked, medication takes are complete, and missing information trigger other actions. So in this area, the network of workflows is hard to replicate. So the agent can learn your referral rules, your payer requirement, and improve over time. Then you have built a durable, sustained system advantage by combining agent orchestration that really help you in this care coordination process. In this area, the care coordination area, there are many, let's say, metrics that you can look at, like the discharge rate, the cancellation rate, that will really help in terms of measuring the impact there. That's mainly where I see the areas of the huge impact and the metrics that's meaningfully have a real deployment, tangible impact also.
Thank you, Ayman, for that. Professor Abhay, you want to add to it? What metric do you feel that matters? You are on mute, Professor Abhay.
Just one addition to what Ayman was saying. So any process which is fully transparent and very low risk, for instance, calling a hospital and making an appointment, or for that matter, taking the basic history, those are the ones which will get adapted fastest because they're fully transparent. There, an error will be very obvious. You have to think from a psychology perspective. Wherever I know, if there's a mistake, I'll pick it up. I'll adapt it. Where I feel, the mistake will go unnoticed. Claim management, I think, is still one level up. Claim management, already we've tried it, and we've actually had some not so good experiences. So don't go where you can't see the whole thing. Adaptation in this journey is going to be about trust building. We will have to start trusting our AI agents. That trust is not existent today.
Correct.
Yeah.
So give them simple jobs like handling a phone call or saying, I want to change my appointment. Yes. I will change it. Or at 2 o'clock in the morning, I can speak with a human voice. So I've got a tummy pain. Who's a good doctor to see me? Or what should I do? So those basic things where everything is observable, that is the key to adaptation.
Right, right. Transparent AI systems, which basically giving visibility to the clinicians or the healthcare operators, is the key to having a system integrated into a hospital system. Thank you, Professor Abhay, for this. Now, the next question would be for everyone, and we can have a raise of hands too, and we can go one by one on this. Like in 5 years, 6 years down the line, especially, I mean, the technology is moving or evolving so fast that every week we are seeing some new innovations happening into the field of AI, agentic AI, or quantum computing has surfaced into the ecosystem right now. So, what do you think? 5 years, I think 5 years would be a sci-fi. I am picturing a sci-fi movie right now in 5 years' time, the way we are moving. So, for a high-performing hospital, 5 years down the line, what would it look like a healthcare provider which has fully embraced clinical grade agentic AI system? What would that look like? Yes, Professor, please.
I don't think it has been left to the hospitals at all. And I can see what adaptation is going to look like. It's going to be led by the individual patient. People have started adopting AI today for ChatGPT. They're getting medical opinions from ChatGPT. ChatGPT started a healthcare center. Guys, it's going to be left to us. So what is going to happen is exactly what happened with the computer industry. And I'll give you a very simple analogy. When I first bought my laptop in the year 1996, I was very, it was a $3,000 machine that I never let anyone touch. Today, my 5-year-old boy will take a pen and say, Papa, you don't understand. I'll just change the RAM. He's 5 years old, right? So that is how technology no longer, we think we are controlling the information, we are controlling the process. No, with AI, what I see happening is people will experiment because people like to take a risk as long as it's giving them some reward. And they will force adaptation on us. Gone will be the days when a clinician will tell that you need XYZ surgery. The patient's going to come and say, I've done my analysis, this is my test result, this is my biopsy, this is what I want you to do. And if a hospital today is not ready to adapt that mindset, it's going to be either, they're going to just perish. They're going to be the millions of other computer companies which perish because they did not adapt to the times. Right? So I can again tell you that it's, by the way, the horizon of 5 years is too long in my eyes. It's the next 3 years. Yeah. If a hospital is not investing in AI today, if it is not having this discussion in their boardroom today, in the next 3 years, they might cease to exist. And I can assure you that this is not only left to the hospital board. Any hospital where the patient feels they get a much better care at a much lower cost is going to be the successful hospital. And AI should be looked at from a patient perspective, not from a clinician perspective, not from a regulator perspective. Regulation will never catch up. So believe you me, the way I see it is the risk is going to get taken. People are going to, it doesn't matter what I think. Yeah. It doesn't matter what we all think. A patient is going to go on ChatGPT and do his analysis and come and force me and say, doctor, you're wrong, I'm going to sue you. The moment I'm actually at the risk of getting sued, I will now accept the risk of a false result, but I'll create my documentation properly. So we are no longer going to lead or be the decision makers of the healthcare journey. We have had that privilege for far too long. And as I see AI actually giving that core medical knowledge to the common man, means that I'll have to change in my practice and my process. And this is the only message I have, that any hospital which really feels that they want to be the best, they'll have to start thinking, how do they integrate this and still manage the risk? Not, I will wait till everyone else is adapted. That's not going to work this time.
Thank you, Professor Abhay. Now we are running short of time, so I'll quickly move to Nishant. Nishant, please try to keep it under 30 seconds if possible. You are on mute.
I'll be very short. I just adding on to what Professor Abhay is saying. I believe it's, as I said earlier, also empowerment of patient is the one thing. When I remember when doctors started coming to me and started complaining that this Google doctor is playing too much now. It is, everybody's coming to me saying, Google, sir, is giving this search result. Imagine Google was not even talking back. AI is not talking back to you. So imagine that they have just taken a single step, not even a big one. It takes the next one and you're not with it. I think you can imagine.
Thank you, Nishant. Does anyone else want to add anything into this? How does it look like, or what is that one capability you will personally fight to have in your organization? So
Yeah, if you allow me, Nishant, that's
yes.
maybe in a small, a few seconds. The analogy that I like about the dream here in 5 years is not to have AI everywhere in the hospital. It is about AI doing the boring part so the human can deal with the human part. And the best analogy that I like is like aviation. So in the aviation, the automation handles all the routine navigation, and the human pilots take over only when the weather changes or system disagree, let's say. So that's what I can see is like agentic mesh, a distributed ecosystem of interoperable agents works in the background as a nervous system of the hospital for all logistic things. But of course, that's a big dream, a lot of foundational requirement needed.
Yeah.
Regulation is a huge thing here.
Thank you, Ayman. Dr. Dev.
Yeah. Now, again, I'm coming back to the senior leadership perspective into this and the funding promoters, basically. One thing in AI you should understand, right now it is comes under regulation. So there is a post-market surveillance of that. So as a healthcare leader, basically, I have to ensure post-deployment, what type of a surveillance oversight I need and governance system I need to place into my place. One for the clinical governance and one for the rest of the governance. Number two, technically, all AI systems over time, they show performance drift. And when multi-agent AIs are used, chances of drifts are more, model poisoning is there. And they can be basically externally with cybersecurity attacks, they can be impacted. So those things need to be looked. Now looking at the 5 years horizon, a very forward-looking hospital, because everyone wants efficiency gains, basically clinical outcome gains, but how to do it strategically. So what I will look into it basically agentic part of AI by definition can act on it. So what we are looking at is a fully autonomous clinical care coordination system basically. Now how it come? One is basically proactive clinical care basically, where when the patient is admitted, not only is vitals and other thing, EHR, everything, but the system itself understand what are the risks and alerts the doctor about the results, schedule this thing. Regarding basically, it can have a hyper personalized care journey for a patient directly. Basically, they can have a longitudinal access to longitudinal health record. They can understand what are the type of the scan or investigation are required, tracking that particular and coordinating with sensors, scheduling appointment, and seeing that he sees the right consultant. So that is another part.
Thank you, Dr. Dev. Sorry to cut you off. We are almost at the end of the time. But we point noted. I understand the technology or the implementation structure that you are trying to bring into it. So thanks everyone for this wonderful, insightful session. What we discussed about various challenges in implementing agentic AI system into healthcare. We discussed about the transparency issue, the reliability issue, the trust issue on a system, the accountability issue, and also we discussed about what would the future look like and what are the things that is required to make it happen. So the clear takeaway is the agentic AI is moving right now from experimental to essential. But when it comes to clinical grade, obviously there is definitely innovations right now. So the hospitals that will win, all the healthcare providers that will win, will demand a provable ROI, strong governance, and obviously taking care of all the innovations that clinicians and non-clinician staffs are facing right now in order to adopt AI systems. So thank you so much panel for this wonderful, insightful session. Over to you, Pankaj.
Thank you, Sujit. I think you have done a fabulous job as a moderator. I think you were able to get real insights from the experts, and you were able to do a really good summary of all the insights that we got today. So thanks a lot, Sujit, for doing this wonderful panel, moderating this wonderful panel. Obviously, I can't thank our panelists enough for being with us today, spending this really high quality 1 hour together to share the insights. I'm sure this is just the beginning, and we will keep finding more opportunities to collaborate and work with each other, support each other, and probably see how we can improve the overall healthcare hospital ecosystem through different kind of innovations, through different kind of partnerships and collaborations. So really appreciate your time today, and let's reconnect later to see how we can partner and improve the overall healthcare ecosystem. Thank you, everybody. Thank you. Bye. Take care.
Thank you. Thank you, everyone.
Bye.
Thank you.